But I would like to invite our next speaker up on stage. Patti White is the founder and CEO of Hemex Health. I actually remember when I met Patti 8 years ago at Ben Venture Conference. And we met at the bar at the hotel. This sounds a little sordid, but it's not.
Yes.
The evening before the event. And I just remember from the first time I spoke with Patti, I was blown away by what they were working on at the time, focusing specifically on malaria and sickle cell. And I just knew that what she and her team had put together and where they were going to do some really amazing things. And I'm excited to say they've done that. And so, Patti, I'd love to have you on stage to tell us about that.
Okay, great, thank you. I'll put stuff down here. I think I have a few pictures I wanted to put up here, but it's really great to be here and to be able to talk to you. And I know we have a lot of Hemex investors that are here. And for those of you that aren't, I'll give some background. Maybe you'll want to become a Hemex investor. Yeah, we're always open to that. So do I just bounce this? There we go. Oh, there we go. All right, great. Well, I'm Patti White. I'm the CEO and co-founder of Hemex Health. And besides meeting people in bars, I really get to run a company that actually can go out and really address how to bring diagnostics to some very underserved markets, and certainly some of the most remote areas that have very high needs. So it's an exciting time for us at Hemex. I'll tell you a little bit about the company and some of the places that we work. So our product's called Gazelle. And Gazelle is really an instrument, you can see it over there, that a small instrument that really can go out and do testing in these very remote areas. And when we thought about Gazelle, we really did the investigation work. We really dove into what would we need to be successful, because clearly big companies were not making equipment that could go to these places and could work. What we really found out in the process of talking to the users is we had some really big constraints. First of all, it had to be affordable, so it had to be something that somebody in the middle class could buy in an area like in Africa or India. Secondly, it had to be simple to use. You weren't going to be able to get somebody who was an advanced technician. Just those people aren't out there in these locations. And then the third thing is it had to be accurate, because we really needed to be able to give information that physicians could treat based on that information. There wasn't going to be another higher level test. So those are really tough constraints that we tried to really build in to Gazelle. And what you see here is our Gazelle, which is the instrument, and then also the new Gazelle Mini, which will be coming out at the end of the year, which is even more miniaturized version of Gazelle. So a little bit is, so how did we do that? Part of this was through technology and really doing a lot of work to look for identifying some technology that only ran in big labs, but then figuring out how do we get that into this small box? And that's where we really looked at using miniaturization to be able to make that happen, and then also using a lot of AI. Now, this wasn't generative AI. It's not the same as today's AI, because this was probably 8 years ago. But we used several forms of AI to make this possible. That's why we can get information, be able to translate this so that someone who doesn't really know anything about a sophisticated test gets the information to be able to take action on a patient. And what we found after we rolled this technology out is that we really were meeting a big need. I mean, the product really started to take off in a number of countries. And what's really exciting about Gazelle in the past 3 years since we've launched it is we've taken over 1.2 million tests. And that means in the average areas where we take the test, you can see the countries that we're in today. We're in 36 countries. In those areas where they're taking the tests, we've probably saved the lives or helped save the lives of 10,000 babies who would not have been tested otherwise. So it's pretty exciting. It's tough places to work, but really where it's something where technology can really come in and make a huge difference. The other thing I'll just mention is that we now have this installed base of readers that's out there. So over 2,000 readers. And actually just this week, we noticed that we just shipped the 1,000th reader out of India to one of these other countries. So, it's amazing that now we have this base of readers we'll be able to add more tests to over time. So I want to talk a little bit about Elevate. It's great to be here to talk about Hemex, but I also want to celebrate the help that we got from Elevate all along the way. I mean, Elevate really helped us instrumentally in the beginning because we needed money to really do the first prototype. Those of you in medical groups know what that's like. You really need to get that first instrument then you can go out and do the clinical studies, really show that you have something that works. Once we did that, then we were able to really go out and raise our Series A. The other great thing about Elevate and working with Nitin is they connected us to the Thai group. And I know a lot of people here are also in Thai. What's incredible is for that group, those people really, from India, really understood what we were doing. They weren't suspicious. They didn't believe that, well, you'll never be able to sell products in these markets. Instead, what they knew was that these healthcare markets are one of the most rapidly growing markets in the world. And so really designing for that can really be a key opportunity. So we really have, right now our series, we're in our early end stage of our Series B. So we've raised money, but through that start that we got from Elevate, really being able to then raise additional grant money, and we've raised a total of $31 million in investor money. And really, really looking to be profitable in 2025. That's really our goal, to get to that point. So one more thing I want to say about Elevate is the great thing is they don't leave you when you go away. We might not be raising money from them right now, but they continue to invest, and they continue to invest their time. And I just want to thank especially Ben, who really helped us when we had to go back to our investors again to really help do the leadership, show up on the calls, talk about why Elevate invested. That was a huge advantage to us, and we really appreciate that. So what we really focused on was sickle cell disease. For those of you that don't know, sickle cell disease is a genetic disease that both parents have to have it, and a child can be born with the disease, but a lot of people just carry the trait. So what happens with sickle cell disease is the blood is sickled and it clogs together in the veins and causes pain crises. So a child that's born with sickle cell disease may live with a lifetime of pain crises, organ damage, and probably early death. And for us, in the markets that we worked with, we were very motivated to bring sickle cell disease because 90% of the kids in the world that are born with sickle cell disease are born in an area where they don't have access to basic testing. So in that case, most of those children all die by age 5. And that's where we can really bring a difference, because if you can diagnose the child in the first 6 months, you can do a lot of treatments that'll avoid lasting damage. And it's very exciting for us to be able to do that. And we also do, in addition to sickle cell, we do beta thalassemia, which also has a big impact. So we've tested in a lot of different places. And when you look for sickle cell, you look for it in babies, you look for it in adults or teenagers that may want to get married someday, because you don't necessarily want them to marry someone else with the trait. And then also we do it for treatment monitoring to be able to see, are the treatments working? And I'll give you just a few examples of what we're doing, because these are the exciting things that are really driving growth in Hemex. Is first of all, in India right now, Prime Minister Modi, who's just about to go through another election, is basically going to be trying to screen 70 million children in the next, or 70 million people in the next few years. So that's a huge business opportunity, excuse me, for Hemex. And it's great right now that we're in a place where we have 500 units out there for testing. Another example would be with Saudi Arabia, where they're looking for sickle cell and beta thalassemia, and really where they tried to test people at the time of getting their marriage license, but that's a little bit late to find out you're marrying somebody with trait. So really what we were doing is a screening project with the government for middle school children to be able to have them find out early on that they were carrying the trait. And then the last example is in Africa, where we just finished a large project that was sponsored by Novartis, where we really tested 6,000 children in an extremely remote area. And what we really showed in that study was that you could take gazelle and use it in a place where people have minimal training, and you can also test at the vaccination visit, because most kids in Africa will get vaccinations, and that's the time when they can be tested with gazelle. So it's really, another exciting use model for us. We have new tests that are coming to gazelle, so we'll be doing more than sickle cell, and that'll be exciting. We're adding those this year. And we really see not only for can we do good things with gazelle and good things for the communities and for the countries, but also really to be able to show that we can drive a good business. We have high margin on our cartridges. We make money on tests from the very beginning. And to really be able to demonstrate that you don't need a lot of subsidies to be able to be successful in these countries if you really come up with the right business model from the beginning. And we really see that, we're making money from all the units that we sell, and we want to continue to do that as we drive volume. So I think as we look forward, the next step for us is, of course, also looking for partnerships and potentially at some point an acquisition. And what we want people to see when they see us is that we have a product that's successfully running in the thousands across the world. It's something that is proprietary and very valuable to even other companies who might even have larger distribution networks than we have. And then finally has a big impact in the world, because in the end, I think a lot of companies are looking for impact in addition to growing their businesses and profitability. So thank you very much. Appreciate the chance to share that with you, and happy to take questions.
Thank you very much, Patti.
Okay.
So we do have time for a few questions. We have a mic over there, and obviously I have a mic as well. So anybody have a question for Patti about Hemex and the work they're doing?
I'd love to hear in these communities how you're overcoming any like stigma against receiving healthcare or testing, and if there's a softer side to the company that's involved in that side of delivering healthcare.
So do you mean in getting investment money in the investment community, or say a little bit more?
More about like uptake of the tests and having people wanting to be tested.
Yeah, it's definitely, it's been interesting because there's a lot of education that has to happen. I mean, it was one of those things that happened in Saudi Arabia, is that most of those kids had no idea of what this disease even was. And at the end, they asked them, do you think this should be done? Should all kids have the opportunity to be tested? Nobody was forced to. And it was interesting because 85% of them said, yeah, we think everybody should be able to know and have that opportunity. And in the US, it's very interesting because while all babies are screened, most people, 80% of the people don't know that they have trait. So it's actually a big health equity issue in the US that people never got that information. It really wasn't passed on. And so that's one of the reasons why we're actually working to get our US approval.
You work with public health departments.
We have time for one more question.
The doctors are the ones who are doing the tests in the actual lab.
In overseas, you're doing, yeah, it's actually usually healthcare workers that do the testing. And, there may not even be doctors around. It may be more like a nurse or a low-level practitioner, but certainly in the bigger cities, you definitely get to work with doctors. And we work with also a lot of key opinion leaders that really help with promoting the technology across the country, for example, in India and in Africa. But, you might only have a few experts in blood diseases for the whole country, so they can't be everywhere.
All right, I think we're going to wrap up there. Let's give Patti another round of applause.
Thank you.